Welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Dr. Tania Gonzalez-Rivera this morning. She's joining us here from GlaxoSmithKline to talk about a recent FDA approval of BENLYSTA for lupus. Welcome to Health Professional Radio, Dr. Rivera. Thank you.
Hi, Neil. Thank you so much for having us here this morning.
Give us a little bit of your background. I mentioned, of course, that you're here with us from GlaxoSmithKline, GSK. What is your background, and how did you come to be at GSK?
So I am a rheumatologist. I practiced for several years in academia taking care of lupus and lupus nephritis patients. So this disease is very dear to my heart, and I joined GSK back in 2016 and working on BENLYSTA for several years now. So I'm very excited to be here and talking about BENLYSTA and SLE.
What is lupus nephritis? What are some of the symptoms?
Sure. So before we talk about lupus nephritis, or LN as we call it, let me take a little step back and talk a little bit about systemic lupus erythematosus, or SLE. Mm-hmm. SLE is a chronic incurable autoimmune disease associated with a range of symptoms, and it can fluctuate over time. Symptoms may include painful or swollen joints, fatigue, fever, rashes. It can also cause very severe manifestations in organs such as the heart, the lungs, and the kidneys. And when it affects the kidneys, that's what we call lupus nephritis, or LN. Sadly, LN can lead to end-stage kidney disease, which may ultimately lead to dialysis or renal transplant. So it's very important to note that LN is an unmet need for SLE patients. And importantly, it can be asymptomatic. So some patients might not be even showing overt signs of it and would only be discovered in blood work or urine tests. For those that do experience symptoms, some potential signs could be weight gain, puffiness in the feet, ankles, swelling around the eyelids. They could have blood in the urine or have a frothy appearance to the urine. Mm-hmm. But it's very important for patients to really follow up with their healthcare professionals so they have proper monitoring and we can catch lupus nephritis early on.
Is this considered a rare condition? How many people would you say are living with LN?
Yeah, in the U.S., approximately 330,000 patients with SLE. Of those, LN can occur in up to 40% of adult patients with SLE. Despite many improvements in diagnosis and treatment, there's still LN remains still an indicator of very poor prognosis, so we really need to catch these patients early on when they express any symptoms of LN. And it's important to get to those goals of treatment for LN and achieve a renal response, prevent relapses or flares of the disease, and potential progression to end-stage kidney disease, and minimizing any toxicity from treatment.
You mentioned that this is an unmet need in this space. What are some of the challenges that cause this to remain an unmet need? Yeah,
so as you can probably infer from what I was mentioning before, it's a very hard disease to diagnose and manage. And we really want to raise awareness of what SLE is and what LN can constitute to patients. The manifestations are very varied, and at GSK, we're very committed to both SLE and LN, and over the years have shown commitment by bringing therapies to patients with both SLE and now with LN.
Now, one of those therapies has recently been approved by the FDA, BENLYSTA. What is BENLYSTA, and what exactly is it indicated for?
BENLYSTA is a class of drugs called biologic. It is a human monoclonal antibody that binds to soluble BLyS, and BLyS is a survival factor for B cells, and it has been implicated in the development and manifestations of SLE. In the U.S., BENLYSTA is indicated for the treatment of patients age 5 or older with active SLE who are receiving standard therapies. And I'm very proud to share, as you were saying, that in December, the FDA approved BENLYSTA for the treatment of adult patients with active LN who are receiving standard therapy. So now BENLYSTA is the first and only approved treatment for both SLE and LN.
So how does it work?
So BENLYSTA blocks a survival factor for B cells, and the substance is called BLyS. So if you block a substance that prevents the survival or blocks a substance that promotes the survival of B cells, and those B cells don't survive as long. And then those B cells that could be harmful or pathogenic in SLE don't survive as long, and decreases the disease activity in SLE.
Now, this FDA approval, is it a standard FDA approval, or is there some type of caveat or anything involved?
Yeah, so what we call the supplemental biologic license application that we submitted to the FDA was originally granted a breakthrough therapy designation and priority review, and it was based on the BLISS-LN clinical trial, which is the largest and longest phase 3 study ever conducted in active LN. We were very excited that our study met its primary endpoint of achieving statistical significant difference for primary efficacy renal response at 2 years when we looked at BENLYSTA plus standard therapy compared to placebo and standard therapy. Additionally, we achieved statistical significance across all the 4 major secondary endpoints, including complete renal response and time to renal-related events or death. Additionally, the safety results that we got from this BLISS-LN trial were very consistent with what we knew from BENLYSTA from its approval in SLE.
How has GSK been able to, I guess, basically break through some of the challenges that are associated with lupus research in general?
SLE is a very challenging disease for patients, for healthcare professionals, and it's been a challenge for drug development. At GSK, we've been fortunate and proud to have had so many firsts with BENLYSTA, and we've been able to connect this innovation with patients. Additionally, we have been able to generate an unmatched body of clinical evidence in SLE, including for adult patients, for children 5 years and older. We have been able to generate data in the real world, so looking at our product at how it impacts long-term organ damage in the real world, and we're very committed in ongoing investment and being the leaders in lupus.
What would you say is next as far as research is concerned in this space for GSK?
So we've been able to achieve a lot of firsts. As I mentioned before, NLN was one of our most recent successes. Currently, we have an ongoing trial called Let's Believe, which is a 2-year trial evaluating BENLYSTA plus a single cycle of rituximab, which is another biologic, aimed at demonstrating sustained disease control while minimizing immunosuppressants and steroids. I'm really encouraged by the progress that we've made and we're making for lupus and lupus nephritis patients everywhere.
Doctor, give our listeners a website where we can learn much more about GSK and about BENLYSTA.
Sure. They can visit www.benlysta.com for more information.
Well, I thank you for joining us on the program. It's been a pleasure speaking with you, Doctor.
Thank you, Neil. Pleasure myself.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tania Gonzalez-Rivera. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.